quite new to our works. And after that, I will also introduce the Islam and Liberty Network as part of the co-organizers, and just give a brief introduction to the topic of our discussion today. So overall, I think I will be speaking maybe for around 5 to 10 minutes before I pass it to you to talk more about the whole topic for around 45 minutes. Is it?
Sure. I will try and
Yeah.
be short.
Yeah. And then straight after, I'm going to invite Ali Salman from Islam and Liberty Network to give some remarks or some inputs on the topic as well before I open up for the discussion with our attendees. So I'm going to be the host for the discussion as well as the moderator, and anyone who, for the attendees to pose any questions, they can do it on text through the Q&A part of Zoom, or they can also post questions audio. So meaning that they can also, I will also allow them to give questions for those who raise their hands using the Zoom app.
Sure.
So overall, I think the discussion will, Dr. Farouk.
Yeah, but then Isan has the liberty to mute the guy if he talks rubbish or something like that.
Yeah. I think I will also limit questions or comments to up to like 1 to 2 minutes so that we can have more room for discussions.
But
depending
I think you forgot one thing, Isan. You forgot to say that at the end of Dr. Nader Hashemi's talk, you're going to give like 10 minutes or so to Ali Salman to give his
again
view.
to conclude the program as well as the closing remarks.
No, I thought it's after Dr. Nader, right? Before you open for question and answers.
After Dr. Nader, yes.
Yeah.
Yes. Before
okay.
I open for question and answers.
Can we get Ali Salman here in Iskandar?
He says he wants to stay as an attendee.
Oh, okay.
For now, yeah. So we'll have to bring him up later lah.
Okay.
All right.
Can we like open now to the attendees because it's already 10?
Yeah, can. Okay, so I'm gonna screen share the thing first.
Okay. Yeah.
So that it'll look like this.
And can you make sure that it's recorded?
Yep.
Yeah. Okay, please.
Okay. Give me a second so that I put it on Facebook Live as well.
How long is that going to last? Okay.
And are you still working on it?
Yep. Okay, so it should be on Facebook now. Then we'll let the attendees in, and I guess I'll just give Ehsan the host lah.
Okay.
Hazim, can you check the Facebook? Is it live now?
Yeah.
Yeah, so it's live, right? Okay. Okay, Ehsan, you're the host now.
All right, thank you.
So yeah, so you can start the thing. You can press the orange thing in the middle, and then we can start.
The broadcast part, yeah?
Yep. And then
All right.
once you press that, I'll mute myself and whatnot.
There's only one problem. I can't access my notes at the bottom of my screen.
I'll stop sharing screen in a bit.
Yeah, if you do that.
Yeah. Once Ehsan starts the
Okay, so I need to start the broadcast first, is it?
Yep.
Okay, there's a part here.
Okay, that's good. Thank you. Good. Thank you.
All right.
Yep, that's very good. Thank you.
No worries. Okay, so I think you can see attendees are already joining in.
All right. Okay, so we are starting now. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good morning to those in Malaysia, and
Evening.
And good evening to Dr. Nader Hashemi is in Denver, and perhaps some other attendees in other parts of the world. I would like to wish you all a very good welcome to everyone participating, attending the webinar that we are conducting today. I will just start with introducing myself briefly. My name is Ihsan. I'm from Islamic Renaissance Front, based in Kuala Lumpur, Malaysia. For those who are new or still unfamiliar with IRF, we are an organization which organizes events and programs in very much related to topics on Islam, democracy, human rights, and related topics of the concern of mainly Muslim majority societies. And in a lot of our activities before, we've invited several speakers and also scholars from Malaysia particularly, but also from other parts of the world. And for today's discussion, we are going to have Dr. Nader Hashemi, who has in several times invited to our events and activities in Malaysia. So I would like to welcome Dr. Nader Hashemi again. Thank you very much for accepting our invite for the discussion. And the event for our webinar today is also co-organized by the Islam and Liberty Network. I will provide the opportunity to Mr. Ali Salman, to the director of the Islam and Liberty Network, to give some remarks as part of our discussion today. So I would like to straight away move into the main topic of the discussion. The highlight of the topic, the main topic of the discussion is definitely the most obvious, though the unseen, the threat that we could say that we as part of the global society, we are currently facing the threat of the coronavirus 2019 pandemic. There's nothing much for me to add when it comes to the details, as I'm sure most of our attendees here, we are looking into the updates on the conditions about this pandemic all over the world, perhaps not just on a daily basis, maybe to some in more like an hourly basis. New updates are being shared, new informations are being shared. But one thing that we can say for sure is that the concern that we are having regarding the condition of the spread of the virus is increasing from time to time and from one area to another area. A very much threatening viral pandemic indeed. just for me, just to share a bit on one of the first time which I heard about the threat of the virus itself. It was actually during a program that IRF was organizing that was way back in early January, in which at that time it was still called the Wuhan virus. And in one of the discussions that we were having, that one of the participants raised that there's the concern about the Wuhan virus has already started to cause several lives. At that time, if I'm not mistaken, it's just between is it like 9 to 10 lives in Wuhan in China. But as we know that the spread, the rapidity of the spread of the virus is very fast, and within just, at the current moment, just after 3 months, the rate of infections and the rates of the number of lives that has been affected by the virus has been increasing rapidly, starting from China and later to Korea and Iran, Italy, and now based on several reports, the US is currently leading when it comes to the numbers of infections and also the cost of lives. And when it comes to, just based on what I've looked into, the current, almost the recent numbers is almost approaching 1 million infections worldwide. And for me, and those for us in Malaysia, the numbers of those who are infected is already almost reaching 3,000 with almost 45 deaths. So definitely the situation is alarming, and a lot of articles, sharings from news reports have covered. Perhaps this is the only main important topic that the world is really now interested to talk into. The effects of the virus at the first stage is definitely on the health and the situation of the people. But besides than that, the concerns of the global community on the economic conditions, how it is affecting the economic conditions, and also how does it also is going to affect the politics, governance, human rights as well. And I was reading several articles, but one thing quite clear that what is being written by various reports and several articles is that the situation of the world may not be the same before this pandemic happened. A lot of changes that might be happening, and we are seeing that, and we are also being affected by the situation. So another observation, which I think is very much interesting when it comes to the situation of the world now, is also how does it relate to the situation of governance in various countries in the world. As we all know that it's even up to now, the world globally is a combination of countries of various democratic and governance system. It is not just a simple certain countries apply a more different types of democracy, certain countries apply different types of governance. But what is quite obvious now, because of the current condition, most countries now, most people in the world now, we are living in something quite a similar situation. As Dr. Nader Hashemi mentioned during an earlier conversation, Denver is in something like in a lockdown. For us here in Malaysia, we've been receiving updates every time about new rules when it comes to social distancing and regulations of movements, even though the term lockdown was preferred not to be used by the government earlier. And these variety of responses also in some ways effect on how do we want to live and how do we want to continue engage with the topic of democracy and rights for now, and perhaps how do we foresee the situation in the future, as knowing that situation of virus is not something that should end immediately. Things could take time on when it comes to how things is going to change. So to continue our discussion further for today, I would like to just straight away introduce our speaker for our discussion. I will just read briefly the biography of Dr. Nader Hashemi. Dr. Nader Hashemi is the director of the Center for Middle East Studies and an associate professor of Middle East and Islamic politics in Joseph Coble School of International Studies at the University of Denver. He obtained his doctorate from the Department of Political Science at the University of Toronto and previously was an Andrew W. Mellon postdoctoral fellow at Northwestern University and a visiting assistant professor at the UCLA Global Institute. His intellectual and research interests lie at the intersection of comparative politics and political theory, in particular debates on religion and democracy, secularism and its discontents, Middle East and Islamic politics, democratic and human rights struggle in non-Western societies, and Islam and the West relations. Dr. Nader Hashemi is the author of Islam, Secularism and Liberal Democracy Towards a Democratic Theory of Muslim Society, and the co-editor of The People Reloaded, The Green Movement and the Struggle for Iran's Future, The Syria Dilemma and Sectarianization, Mapping the New Politics of the Middle East, which was published in 2017. Based on that brief introduction, I think it's time for me to pass the discussion to Dr. Nader Hashemi to share his inputs, and later we will open up for discussions and questions and answers with the attendees. To you, Dr. Nader Hashemi.
Well, assalamu alaikum, and thank you for the invitation and a welcome to everyone who's watching this event. I want to especially thank the Islamic Renaissance Front and the Islam and Liberty Network. Thanks to Ahmed Farouk Musa and his team, and to Ali Salman for their efforts in putting this event together. I've been to Malaysia 4 times at the invitation of the Islamic Renaissance Front, and I've been deeply impressed by the work that they have been doing on human rights, democracy, and Islamic reform. A lot of the work that the Islamic Renaissance Front does overlaps with my own personal conception of Islamic ethics. So I find it very hard to say no to them when they issue me an invitation. The question that I want to pose tonight and then answer is the following. Are authoritarian regimes better equipped than democracies to handle the challenge of a pandemic? Are authoritarian regimes or authoritarian governments better equipped than democracies to handle the many challenges that flow from a global pandemic? And I want to answer this question both theoretically and practically against the backdrop of our recent global crisis, the coronavirus pandemic, with special comments at the end on the case of Muslim majority societies. But let me just say something about this particular historical moment. 3 months ago, no one knew or had ever heard of the coronavirus disease or COVID-19. Now this virus has spread to almost the entire globe. It has crashed economies. It has broken healthcare systems. It has filled hospitals and empty public spaces. It has separated people from their workplaces, from their friends, and from their family, and has disrupted modern society on a scale that we've never witnessed before. It's difficult to appreciate the magnitude of this particular historical moment because we are just in the beginning phases of it. We are in the middle of it. But I do believe this is a transformative moment in global history. The coronavirus pandemic really has changed our world, and there will be no going back to the world that we once knew prior to the emergence of this virus. Yesterday, the UN Secretary General Antonio Guterres said that the coronavirus outbreak is the biggest challenge facing the world since World War II. He said that it could bring a global recession that has no parallel with the recent past, and you just have to look at the numbers around the world to appreciate this point. Approximately 1 million people have been infected by the virus. Roughly 50,000 people have been killed, mostly in Italy, Spain, the United States, France, Iran, in China. And the death toll here in the United States, where I'm speaking from you now, is approaching 5,000 deaths. There were more than 200,000 cases roughly in the US, and scientific projections are that if the United States is lucky, over the next month, about 100,000 people will be killed. That's if the United States is lucky, and if all of the mitigation strategies that are put in place are respected, the United States will be lucky to get away with losing about 100,000 people. Just to give you a sense of the magnitude of what's happening here in the United States, yesterday, according to the Johns Hopkins Coronavirus Resource Center, roughly 900 Americans died as a result of the coronavirus. That's just in one day. And the predictions are that over the next 2 weeks, these numbers are going to increase significantly. Now, it's important to point out that we were warned about this coming pandemic for several years. Experts in the field have been saying for a very long time that something like this type of pandemic was inevitable. In recent years, there have been hundreds of health experts who have written books, essays, articles, given speeches, warning of the possibility of a crisis like this. Just to single out one person, Bill Gates has been telling anyone who would listen that a global pandemic was inevitable. In 2015, if you look at his famous TED Talk that's available on YouTube, he was incredibly forward-looking and prescient in warning about this particular crisis. If only we had listened to him back then. And fundamentally, I think this crisis that we are facing challenges fundamental core assumptions about the world that we live in, about international affairs. It forces us to rethink key concepts such as what really constitutes international security. It forces us to rethink the concept of sovereignty. It forces us to think about, in a much more deeper way, the idea and the notion of international cooperation, the value of human rights, particularly in the context of what constitutes good public health. And also, this crisis forces us to rethink fundamental notions of good and responsible government. Writing in the Guardian newspaper recently, David Runciman has written, quote, "This crisis has revealed some very hard truths. National governments really matter, and it really matters which one you happen to be living under. Though the pandemic is a global phenomenon and is being experienced similarly in many different places, the impact of the disease is greatly shaped by decisions taken by individual governments." And so this forces us to turn our attention to the broad relationship between politics and this pandemic. And so I want to say at the outset, I'm not an epidemiologist, I'm not a physician, I'm not a virologist. My training is in political science with a focus on the Muslim world, the Middle East, and the Islamic world, focusing on questions of democracy, authoritarianism, human rights, and struggles for democracy in the Muslim world. So I want to really grapple with this question, a fundamental question in politics, the relationship between democracy, authoritarianism, and notions of good government. So let me just repeat the core question that shapes my presentation this evening. Are authoritarian governments better equipped than democracies to handle the challenges that flow from a pandemic? Recently, the Director General of the World Health Organization, when he was commenting on this global pandemic and the outbreak of the coronavirus, publicly stated that China deserves special praise and recommendation for its response to this crisis. Quote, "In many ways, China actually is setting a new standard for outbreak response. And that's not an exaggeration," he said. As the new disease grew into a global health crisis, Chinese officials have quarantined entire cities in a matter of days, suspended travel, closed schools and universities, shut down businesses, and imposed strict restrictions on who could leave their homes. In many ways, China has sort of set the standard here to what other countries around the world have emulated in terms of dealing with this pandemic. Local researchers in China have rapidly sequenced and shared the virus's genome, allowing labs around the world to work on their own diagnostic tools. Authorities in China have built specialized hospitals in a matter of days. China's state-owned media has broadcast to the world the efforts that it has undertaken to deal with this crisis. They've leveraged their formidable surveillance powers to scale up contact tracing, which is an essential measure in stopping the outbreak. And even Donald Trump, of all people, has tweeted in praise of China's, quote, great discipline in dealing with this crisis. World Health officials have repeatedly praised China's response. There was a conference in Munich in February where Michael Ryan, who's the executive director of the World Health Organization's emergency response program, argued and publicly stated that the people of China today feel protected. Quote, they feel like their government has stepped in aggressively and quickly to protect them, he said. And then he added, this is the ultimate social contract between any government and its people, end quote. Now, during public health crises, governments in the United States and other liberal democracies are often forced to consider various measures that require health checks, that require limiting movements, instituting quarantines, and this often infringes on individual liberties and human rights. Thus, it is sometimes argued and believed that in moments of a pandemic, liberal governments are not as effective in responding to these moments of crisis. They allegedly, liberal democracies that is, allegedly have weak governments because they have to respect popular choice and legal procedure. Some people have suggested that perhaps this recent global crisis reveals that authoritarian governments are better equipped than democracies to meet the challenge of a pandemic. And this is, of course, related to a much broader global debate that has been taking place in recent years about the value of democracy and perhaps the appreciation or a reconsideration for more authoritarian styles of government. The China model is sometimes discussed, particularly in parts of the Islamic world, as perhaps a better alternative to democracy. Western democracies, after all, today are in deep crisis. There's lots of political polarization, lots of confusion, lots of uncertainty. And just look what's happening right now in the context of this global pandemic. Look what's happening in some prominent Western liberal democracies, where the 4 top countries in the world now who have produced the largest number of cases and deaths are in Western liberal democracies. Italy, Spain, France, and the United States top the world in this category, while comparatively speaking, China's numbers, despite a much larger population, are much lower. Now, of course, Donald Trump's mismanagement of this crisis obviously does not reflect positively on democracy or the ability of a democracy to respond effectively to a pandemic. And some people have argued China, in contrast to the United States, has really shown some significant global leadership by containing and stopping the outbreak after it first emerged, by sending medical aid and testing kits to countries around the world, by sending surgical masks and other forms of personal protection equipment. In many ways, some people have argued China is now demonstrating global leadership that we need more of, as opposed than a leadership coming from the West, from the United States and Europe. Perhaps some people have argued that one of the lessons of this moment of crisis is the China model, and perhaps we need to rethink the China model and rethink the values of authoritarian government during times of crisis. Take a second look, in other words. Now, this narrative that I've just constructed, let me state very clearly and very accurately, I strongly disagree with this claim. Opponents of democracy and human rights around the world would very much want us to buy into this narrative. I think it is deeply flawed, deeply disingenuous, deeply ethically weak, and it would be a danger for our world if more countries were to buy into this story. Let me explain why. Good public health practice doesn't simply require political control. It also requires transparency, public trust, and social collaboration. Habits of mind, in other words, that allow free societies to better respond to pandemics. Citizens of democratic nations can reasonably expect a higher level of honesty, candor, and accountability from their governments, as opposed to citizens living in authoritarian regimes. American citizens, for example, today are benefiting from the objectivity and the accuracy of the U.S. Centers for Disease Control and Prevention, known as the CDC. This is a leading public health institute in the United States. It's federally funded, but it's independent, and it publishes regular, accurate, and independent information about infectious diseases that can be a critical source of information for citizens trying to figure out and understand what's going on. The CDC has a long, distinguished history in terms of being a forum for communicating between and with American citizens over these questions of pandemics and infectious diseases. Thus, reliable reporting has enabled epidemiologists in the United States today to accurately and honestly, without government interference, to predict this disease's trajectory. It has helped research develop treatments and vaccines and to respond to the transmission of these diseases in ways that can protect society at large without having to fear the executive power coming in and trying to manipulate the data. In contrast, consider the case of China. In 2003, when we had the SARS outbreak, China tried to cover up that story when it first emerged. And it's also trying to do the same thing in the context today of the coronavirus crisis. Local authorities in China deliberately suppressed early reports coming out of Wuhan of some unknown virus that had emerged, missing an early window that responders had to stop this infectious disease before it spread around the world. Although researchers in China did eventually release the virus's genetic sequence, there was a lot of an attempt to cover up what was happening. There was an attempt to detain doctors, to silence whistleblowers who tried to discuss the disease and tried to sound the alarm when the evidence started to emerge in late December of last year. Aggressive action just a week earlier, in, let's say, early to mid-January, could have cut the number of infections in China by 2/3, according to a major recent study, whose authors include experts from the Wuhan Municipal Center for Disease Control and Prevention. Another study has found that if China had acted earlier, had acted responsibly, it could have controlled the outbreak and it could have prevented 95% of the disease spreading to the entire world. One of the doctors who was in Wuhan at the time, who tried to sound the alarm, was Li Wenliang. He tried to warn friends on the social media service WeChat about this crisis that was emerging, but he was immediately summoned before the authorities of the Chinese Communist Party, and he was forced to publicly disavow his concerns. He later died of the complications from the COVID-19 virus. And when asked on a BBC interview about Li's treatment by the Chinese authorities, a Chinese diplomat shrugged it off, dismissed it, and tried to blame it on local authorities. But this is precisely the point. China's cover-up of the virus was not the result of some system malfunction. In an authoritarian regime, the state covers up events and stories that it doesn't like as a deliberate policy. This is by design. This doesn't happen by accident. The language of authoritarianism, the language of fear, and the language of force is part of the DNA of authoritarian regimes. In the context of a global pandemic, as we are seeing today, the results of an authoritarian regime relying on those policies can be catastrophic for our entire world. Let me just sharpen the point and ask the following question. It's very difficult to imagine a similar cover-up taking place in a democracy, a healthy democracy, that somehow the state would try and arrest doctors, throw them in jail, imprison them, torture them, and force them to come on television to publicly confess that what they were discovering was somehow a hoax. But this happens routinely in authoritarian regimes. But let me say something, I think, a bit more foundational to the question of global pandemics, and that revolves around the concept of public trust, or sometimes the concept is known as social trust and its relationship to pandemics. During a public health crisis, a government's credibility is a vital national asset. To slow the spread of a virus, the government must convincingly inform and instruct the public. And to do so, it must inspire trust among citizens. Trust that the government is following the scientific data, that is acting out of the best interest for the entire population, and that's enforcing measures that will help keep the public safe. Trust fundamentally depends on transparency. If governments appeal to be lying, concealing the truth, withholding information, their credibility can quickly crumble, and they will be unable to mobilize citizens collectively to do the right thing to deal with the crisis. Public trust is also, it has many dimensions. It's vertical and it's horizontal. So there's one form of public trust that is fundamentally a relationship between the state, the government, and its citizens, but there's also horizontal trust, how citizens view each other, whether they're fearful of each other, whether they trust each other during a moment of crisis. That's an important level of trust that can easily be broken if governments are not responsible in doing the right thing. So recently, in the context of this debate on global pandemics, the prominent American political theorist and public intellectual Francis Fukuyama has weighed in on this debate. He wrote an essay earlier this week in the Atlantic magazine where he argued that we have to discard simple dichotomies when thinking about governments and their response to global pandemics. He argued that the major dividing line in effective crisis response will not place autocracies or authoritarian regimes on one side and democracies on the other. Rather, there will be some high-performing autocracies and some with disastrous outcomes. There will be also, in a similar way, some governments in democracies that perform relatively well and some that perform relatively poorly. The crucial determinant, Francis Fukuyama argued, in performance is not the type of regime, but the state's capacity, and above all, the trust in government. Let me repeat the core aspect of his argument. He says the crucial determinant when we look at global government responses is not the type of regime, democracy or authoritarianism, but whether a particular government has capacity to do the right thing and to instill trust in its citizens. Now, I want to respond very briefly to this argument because I fundamentally agree that regime type doesn't matter. I think when this crisis is over and when we examine the behavior of democracies in the world and authoritarian regimes in the world to this critical moment that we are facing, I think the empirical evidence will suggest, all things considered, that democracies have performed better than authoritarian regimes in managing this crisis and in saving lives. Yes, there will always be outlying cases. There will always be the case of Singapore. There will always be the case of Qatar. There will always be the case of the United Arab Emirates. But these, I think, are non-representative of most authoritarian governments and how they have responded to this global pandemic. Point number 2, speaking of social trust, in general, when we think about the concept of social trust or public trust, there is typically much higher levels of social trust in democracies than in authoritarian regimes. And this is because of the concept of political legitimacy. Regimes and governments that are legitimate in the eyes of their citizens usually have much higher levels of social trust than in authoritarian regimes. And thus, in that sense, regime type does profoundly matter when we think about social trust as an important value. Now, Francis Fukuyama, if you read his essay, he's very skeptical about the case of democracies responding better than authoritarian regimes, largely based on the example of Donald Trump and the United States. And I think this is a problem with his argument because he's using an example of the United States, which today is a deeply flawed democracy. I would argue it's a declining democracy, and he's trying to make broad generalizations about Donald Trump's response as a representative of democratic government for his argument. I would argue, rather than looking at Donald Trump and the United States as an example of a democratic response to this global pandemic, what about South Korea? What about Taiwan? What about Germany? What about Canada? I think those government responses, all of them much more democratic than the United States, does challenge the claim that it doesn't really matter whether it's a democracy or it's an authoritarian regime. It's really about state capacity. Some people now will argue, well, what about the huge loss of life in Italy, Spain, France, and the United States? These are leading democracies, at least historically speaking, and look at the huge catastrophe that is unfolding as I speak. I would argue that the loss of life in the number of cases would probably be much greater had these governments been authoritarian rather than democratic. It's still too early to tell. I think there's going to be a lot of careful examination of all of these examples moving forward. But I wouldn't simply look at the data right now and look at the countries that are experiencing high levels of reported cases and high levels of death. In fact, I would argue that the reason why there's high levels of cases being reported in these countries is because there's a lot of testing and there's a lot of an attempt by government to get involved and figure out how big of the problem is, which is actually a positive reflection on democracies. It's not really a criticism. Now, Francis Fukuyama also, I want to argue, ignores one of the key lessons from the 1918 pandemic. If you're following what's happening today, I strongly recommend that you go and revisit what happened roughly 100 years ago when we had another pandemic that seems to be similar to what we're experiencing right now. About 100 years ago, about 500 million people, 1/3 of the planet, became infected with a form of influenza that is sometimes known as the Spanish flu or as swine flu. The number of deaths that occurred in 1918 as a result of this pandemic was roughly in the range of 50 million people worldwide. In the United States, the number of people who died was 675,000. That's more than the number of people that died in World War I, World War II, the Korea War, the Vietnam War, the Iraq War, and the war in Afghanistan. So it was a major pandemic. And in a major book on this topic that was a New York Times bestseller called The Great Influenza, The Epic Story of the Deadliest Plague in History, the author, John Barry, argues that one of the key lessons from this moment of history is that it is absolutely essential for governments to tell the truth. Truth is directly linked to public trust. And as he says on the last page of his book, the way to do that is to distort nothing, to put the best face on nothing, to try and to manipulate no one. And when he was asked, the author was asked about the consequences of lying back in 1918, because that's what was happening. In 1918, the US government was still in World War I. It didn't want to acknowledge the evidence that was emerging that there was a major pandemic on its doorstep. There was a lot of lying and distortion, and the consequences of that lying were actually very catastrophic. It led to more deaths. So John Barry, when he was asked about the consequences of lying in the context of a global pandemic, he responded with the following comments. Lying was a disaster. People lost faith in everything, in their government, in what they were being told, in each other. It just isolated people even further. If trust collapses, then it becomes everyone for themselves, and that's the worst instinct in a crisis of this scale. In most disasters, communities come together, and that was the sense in some places in the United States, but not in others. And he says, in my book, I wrote about the gradual disintegration of trust at every level of society and the cascading effects it had on social breakdown that resulted from it. But he also adds that there are some practical consequences. For example, the lack of trust made it harder to implement critical public health measures in a timely way because people just didn't believe what they were being told by their government. And by the time the government was forced to be transparent about what was going on, it was mostly too late. Hundreds of thousands of people had died. The virus was widely disseminated. And so the lack of trust, the lack of honesty, the lack of telling the truth costs lives. Getting back to our discussion about governments, truth-telling, honesty, transparency are not core features of authoritarian regimes. Democracies are much better at telling the truth for obvious reasons. Free press, civil society, respect for free speech and inquiry, the existence of an opposition party. Finally, with respect to this debate on authoritarianism and democracy, let's not forget a fundamental truth about the crisis that we are facing right now, known as the coronavirus pandemic. We are in this mess in large part because of the policies of a deeply authoritarian regime that lied, that distorted, that covered up, and that continue to hide the truth about the origins of this virus and the number of people that have been contaminated by it. I'm talking specifically about the policies of the Chinese Communist Party and its notorious ruler, Xi Jinping. Had China not lied, not arrested doctors who tried to sound the alarm and who tried to contain this virus, arguably, we would not be having this conversation tonight. Our world would be much different. So thus, regime type profoundly does matter when it comes to dealing with global pandemics. Let me now just quickly turn to, I realize I've been speaking for roughly half an hour. Let me now quickly turn to the case of Muslim majority societies. I recently got my research assistant to look up the data on how Muslim societies have been affected by the coronavirus. And he looked at all of the members of the Organization of Islamic Cooperation, the OIC, and listed the data in terms of the number of reported cases of infected people and the number of deaths. And several things stand out when you look at this particular data. Number one, Iran is way off the charts. It's very high in terms of the numbers of reported cases and the number of deaths. Iran currently has about 50,000 reported cases and about 3,000 dead. Most people who know Iranian politics realize that the figure is probably much higher given the nature of the authoritarian regime in Tehran. But those are the official figures: 50,000 cases, 3,000 dead. The other thing that stands out is the next country that registers cases and deaths is much lower, is Turkey. Turkey officially has about 15,000 cases of infections, about 277 deaths as of today. Malaysia is third, about 3,000 infections, 45 people who have died. Pakistan and Saudi Arabia are much lower, about 2,000 reported cases and about two dozen dead. Now, this raises some very interesting questions. What about the most populous Muslim majority countries? How come they have not registered? They don't appear on the global data for coronavirus infections or deaths. Indonesia, Bangladesh, India, Egypt, Nigeria. The numbers are almost infinitesimal. If you look at the data on a global scale, it's as if, these countries have almost been unaffected by this virus. And I think the only explanation that one can come to is actually quite a tragic and catastrophic explanation. It means that the level of testing has been very low, that the virus is just beginning to spread, and that what we're seeing today in the United States, in Italy, in Spain, in France is going to hit the countries of the global south, of the developing world, many of the Muslim majority societies, in catastrophic ways in the coming months. There's a lot to be concerned about here because I think the worst is yet to come to these countries. Let me just say something in the end briefly about Iran, because Iran is at the top of the world in terms of this global pandemic. And I think Iran is a perfect example of the argument that I've just outlined. the reason why Iran is in this deep crisis is fundamentally because the nature of government there, the nature of its political system, which is authoritarian. It badly mismanaged, it badly mishandled this crisis from the beginning. The former health minister of Iran was sounding the alarm in late December that something was happening with China. We have to take precautions. No one listened to him. And the reason why no one listened to him, because Iran was facing its own internal political crisis and foreign policy crises. In January and in February, Iran was engulfed in a series of events related to public protests, related to the conflict with the United States, related to the shooting down of this Ukrainian airline disaster, and related to the broader fact that, Iran suffers from an internal crisis of legitimacy. The regime does. There's been a lot of mistrust, a lot of questions about whether the ruling clerics have popular legitimacy. And the focus of the regime in the month of February was not on fighting this pandemic. The focus of the regime was trying to shore up its sagging legitimacy around two important events that happened to coincide in the month of February. One was the anniversary of the Iranian Revolution, which is a huge moment when the regime tries to bring people out in the streets to send a message to the world that has popular support. So that was the focus of the regime. And then around 2 weeks later, there were parliamentary elections. And the regime again was trying to encourage people to come to the ballot boxes after they had screened most of the candidates and had created a situation where it was a very fraudulent election. So people didn't want to show up. And in fact, the Iran Supreme Leader came pretty close to acknowledging this fact when he said one of the reasons why there was such low voter turnout in the parliamentary election was because of these exaggerated fears of a virus. And so if you look at how the government in Iran has responded to this crisis, it's fundamentally a fact, and it's fundamentally a feature of the authoritarian nature of the regime in Iran. The fact that it suffers from a crisis of legitimacy, the fact that its supreme leader about 10 days ago went on television and engaged in a series of conspiracy theories with respect to this virus, saying that it was within the realm of the possibility that this virus is an American plot, an American concoction sent to Iran to subjugate Iran. He even said that there may be this unique Iranian form of virus that has been created by the United States to affect Iranians disproportionately. Just wild, exaggerated sort of conspiracy theories saying that we don't want foreign help and we don't want foreign doctors because the doctors might come to Iran and try and spread the virus, not contain it. And this is from the most powerful political leader in Iran's political system saying these things. How can you have an effective public health response when the most powerful person in your political system is engaging in outright conspiracy theories? So I think that largely explains, if you look at the response in Iran, the fighting between the government and the supreme leader and the Revolutionary Guards over how to handle this particular crisis. It's a textbook study of how authoritarian regimes are uniquely unprepared for responding to global pandemics because their fundamental concern is maintaining political control, maintaining political power, and dealing with their own crisis of legitimacy, not dealing with questions of public health, and not dealing with global pandemics. We could talk more about what's happening in Egypt. I think Egypt is a disaster. Just to cite one thing that's relevant in Egypt, there was a very credible journalist working for The Guardian, Ruth Michelson, who wrote a very good report on what was happening in Egypt with respect to this coronavirus. She was arrested, interrogated, and kicked out of the country. And that gives you a sense of what's happening in Egypt. No surprise there. General Abdel Fattah el-Sisi is behaving like we would expect him to behave, to sort of control the narrative, to control what's happening, blame the coronavirus on the Muslim Brotherhood. These are things that you hear on Egyptian television. So let me just conclude then very quickly with some comments. I think this is a critical moment, and I think it's a very dark moment, not just because of the loss of life that we're seeing, and that is expected to increase as we move forward in time. But I think politically speaking, one of the negative consequences that we're going to see around the world is governments are going to try and absorb more power into their own hands, using the argument that this is a national emergency, that we need to consolidate power, that we need to create large and powerful, stronger states where power is concentrated in the hands of government because we have to deal with the crisis. And I think this is a very bad omen, and it's a very bad development for those people who believe in democracy and accountable government. We're seeing the signs of this already. Earlier this week, one of the most notorious authoritarian leaders in Europe, Viktor Orban in Hungary, has led the way. He rammed through parliament a legislation that allows him to rule by decree for an indefinite period of time. And also it allows him to criminalize anyone who allegedly is spreading false information about the coronavirus, and they can be sent to jail for 5 years. And so this type of power grab is going to be, I think, used by other authoritarian regimes invoking very similar arguments. In Cambodia recently, a new law was proposed, again, along similar lines, that there's a national emergency and the Cambodian government requires unlimited and unrestricted emergency powers. And, you know, if you follow what's happening there, human rights groups are saying this spells the end for any prospects for democracy in Cambodia. It's the type of power grab. Human Rights Watch issued a statement that this is a dictatorial set of policies that we haven't seen in Cambodia since the time of Pol Pot. I'm quoting from Human Rights Watch. And other countries in the world are gonna use this. We're seeing it in Israel. I predict that Donald Trump, as we get close to the November election, if there's a similar crisis, is going to try and use this moment to either delay the election or manipulate this crisis to perpetuate his own political rule. One final comment. The UN Human Rights Office issued a statement recently on the coronavirus that said the following: over the last years, we've witnessed the adverse consequences of the marketization and privatization of a number of essential services, including healthcare and public health. This is allegedly done under cost-saving economic arguments, but as we're seeing right now, this type of privatization, focusing on economic indicators as opposed to public health, has catastrophic consequences precisely during moments of global pandemics. I think one of the lessons here that we have to learn is that it's not simply sufficient to focus on economic growth, high GDP numbers or high GNP numbers, and think that's the way forward. Obviously, we are learning a very hard lesson that no one is safe in our contemporary world in the age of the coronavirus. You're only as safe as the weakest person on our planet who can spread this virus and contaminate, thousands of people just by virtue of close contact. So this forces us to, I think, much more globally, to think about global cooperation, to think about responsible government, and all of those things, both international cooperation and responsible government, are core features of healthy democracies. They're not core features of authoritarian regimes. And that's why I think one of the lessons, one of the takeaways now is that democracies matter much more than they ever did for our planet. Thank you.
Thank you very much, Dr. Nader Hashemi, for a very much comprehensive presentation on the relations of governance, different types of governance regimes, and how does it relate to the current pandemic situation of the spread of the virus COVID-19. Before we continue with opening up for a question and answer session, I would like to invite Dr. Ali Salman from Islam and Liberty Network to also contribute to our discussion today. I will just put Dr. Ali Salman talk. Dr. Ali Salman, are you there?
Yes, Ehsan, can you hear me?
Yes, we can hear you clearly. Please proceed.
Okay, thank you. Thank you so much, Dr. Nader Hashemi, It's a pleasure to again hear from you and see you actually speaking on this, of course, the most important topic. And I think in my remarks, I was thinking that there is, on this topic, I broadly agree with Dr. Nader Hashemi emphasis and the distinction between the authoritarian regimes and the democratic regimes. And I think his extension of the same hypothesis to the Muslim majority countries is also more or less, I think, agreeable. And so I would say broadly, I agree. And I can also cite a couple of examples, more positive examples, as like Dr. Nader mentioned about Malaysia, also mentioned about Pakistan, Bangladesh. There are countries also like Tunisia, which have actually done quite well in terms of informing their public, and some of these countries like Malaysia and Tunisia have invested historically quite well in the public health systems. Mm-hmm. And I think that has also played a role in sort of maintaining a level of trust. Dr. Nader Hashemi mentioned about trust a number of times today, which is very, very crucial in this day and age. So that kind of investment in the public health system has helped containing the crisis, I think, in some of these countries. And despite of the spread of infection, people have exhibited confidence in how government is responding. And on the other hand, in countries like Pakistan and Bangladesh, where the sufficient investment in the healthcare system was not made over years, despite of the fact that they are functioning democracies, and I would say rather noisy democracies, we have not seen the same level of trust from the public. And one of the reasons that the reported cases of coronavirus and infection is low in these countries is obviously due to lack of trust of the public in these systems, in the systems which these countries have developed. There have been stories from my home country, Pakistan, that people are afraid of reporting because they have seen the conditions in the hospitals or heard of conditions of hospitals where they are subject to isolation. The conditions are not conducive, not healthy at all. And so they would rather not report themselves if there are any conditions they experience. So I think that the numbers can be misleading in the countries where the public health system is not sufficiently developed. So that is one point I would like to mention, that apart from the regime type, democracy versus authoritarianism, I think the quality of healthcare system has also impacted the number of reported cases and the level of controls. Give you another example is actually, if you just to sort of challenging this also hypothesis in the Gulf and also Saudi Arabia, in Gulf countries where obviously we have there are authoritarian regimes, or at least there is no democracy, but we have seen comparatively I think well-established public health systems in these countries, and these countries have taken reliable measures to contain the virus, to educate the people, to inform to inform the public in general. And today, Dr. Nader also emphasized on the importance of being truthful to your public. Information has to be shared transparently, which is so crucial. And I think in that respect also we see some good examples in these non-democratic Gulf countries, essentially because I think these countries are relatively more developed in terms of economic and economic infrastructure, economic growth, public health systems, and they can therefore, I think, afford to take these measures. So I would just like to, bring in this aspect in this hypothesis and maybe problematize it further. That maybe by looking at this aspect into the quality of the public health system, we can explore more dimensions. There's also this the other dimension of this topic. Today we have not discussed economy actually, because of course this is not the topic today. But towards the very end, Dr. Nader mentioned about how marketization or privatization has also created a problem. And to this, I think I would offer a slight disagreement. What I'm seeing is across the world and developing countries, developed countries, especially those countries which are very much dependent on trade. So Malaysia is a good example of a small open economy, which is very much dependent on trade. These countries are going to suffer in the long term more due to the economic blockade imposed by the measures the government has taken in terms of restrictions on the supply chains, restrictions on movement. And this is something which we have not been able to comprehend so far. Governments all over the world are announcing stimulus packages, more intervention, heavy budgets. But this is linked back to the question of democracy, which Dr. Nader mentioned, that actually this crisis has unfortunately given more opportunities to at least some type of government and some politicians, or most politicians perhaps, to expand their power. And this is going to be a problem not just for political and civil liberties. This is ultimately going to pose a challenge also in terms of economic liberties. And I was told yesterday this example. For instance, Malaysian government has imposed restrictions by saying that we will allow only essential goods or essential products to be in the market, and non-essential businesses should be closed down. But then this distinction between essential and non-essential is quite lost, in the sense that, for instance, a large multinational operating in production of food complained that we can continue to operate our factories, but then transport, packaging, which are now declared non-essential, are locked down. And so obviously they will also close down, which will lead to maybe a food shortage. I hope not, but maybe a food shortage. It can happen in also other countries which are dependent on the flow of goods across borders and flow of goods within the borders. So what I'm saying is that I think when we talk about the crisis and the role of the government in mitigating this crisis, we should also be watchful of how this crisis may lead to a greater presence of the government in the name of good, in the name of good intentions, but then ultimately it can also lead to a curtailment of our rights, and that is all interlinked. Ultimately, it will affect the quality of democracy. Ultimately, it will affect the quality of the rights we enjoy, and ultimately, it will also affect even the nature of the welfare regime or welfare systems that we ought to see in the world. So I think these were my couple of interjections. So first of all, as I mentioned, we need to bring in the investment in the healthcare system, perhaps, to see the differences, and secondly, to emphasize even more the importance of maintaining trade flows, supply chains in this moment of crisis, because ultimately the economic dimension is going to hit us even harder than the physical dimension of this crisis. Thank you. I look forward to more discussion.
Thank you very much, Dr. Ali Salman. Straight away, I'm looking into the questions being asked by the attendees. So far, there's 3 questions. I will start with the first question by Adriana to Dr. Nader Hashemi. What is trending now is that there will be a new normal post-COVID-19. What do you envision this new normal to be? Currently, there are also issues faced by certain societies with no access to houses. How to stay home then, clean water, soap and food, for example, asylum seekers, refugees, etc. Because we understand that we cannot really say or foresee that how long would this crisis happen to be. And at the moment, there are certain segments of the communities that are facing even more difficulties by being in this control movement situation or in lockdowns in some countries. How do they sustain themselves economically, and how does this also relates to their own situation? Perhaps you can comment that, Dr. Nader.
Yeah, no, that's a very good question. It's a very good question that doesn't have an easy answer. I read a fascinating piece about a week ago in the context of social distancing, and someone made the observation that in the context of many developing societies around the world, this author was talking about India, she made the argument that social distancing is a luxury that most people in the developing world can't afford, because to social distance yourself or to stay at home for many people around the world means that their children don't eat food. And so for many countries, I think what's happening right now, this new normal, if you will, where we in the United States, just sort of stay at home and work on the internet, that's a function of advanced economies with high levels of economic production and higher standards of living. But when you start thinking about the consequences of this pandemic in poor societies where people live day to day and they don't have the option of staying at home, then you're looking at a catastrophe. Not just I'm leaving the health consequences of the pandemic aside. I'm talking about economic activity, sort of the point that Ali was hinting at. People just can't stay at home. The broader point that was also mentioned is that in broken societies, in crowded societies, in refugee camps, what does social distancing mean in the context of a Syrian refugee camp in Turkey or in Idlib province? There is no social distancing. So if the virus spreads there, that means that thousands of people will be vulnerable. So I think what we're seeing here, the point that I'm trying to convey, that we are just at the beginning of a potential global catastrophe. The tens of thousands of deaths that we're seeing in Europe now and in the United States is going to really pale in comparison if this virus spreads in large parts of Asia, large parts of Africa. And it's also going to have this, drastic economic effect where people are going to start to starve because they can't make a living anymore. There's no economic production and they can't feed their families. So this is going to put a huge, I think, burden on governments in Indonesia, in Bangladesh, in India, Pakistan, in Egypt. Egypt has a population of 100 million people now. What happens when the virus spreads there? How long can people actually stay at home and quarantine themselves? A week, 2 weeks, but what happens after that? So I think, there's a lot to be concerned about here. And the prognosis, unfortunately, from my vantage point, does not look very good.
Mm-hmm. Going through next question. This one is question from Muhammad Rizwan Ul-Haq. If it's just about regime type, what about poor democratic countries where the capability of the state, economic and health quality is not solid enough to deal with such a pandemic caused by an aggressively infectious pandemic? Because I can see that most of the government's response, including in Malaysia, when the situation of lockdowns or something like an emergency response situation is introducing with new mainly economic packages. It's not just about dealing with the management of the healthcare situation of the pandemic, but also introducing some economic stimulus on how to maintain the economic situations to continue. But in what about countries? If you could give some inputs on countries which is basically democratic countries, but without such economic strength and also public health management properly, how would you foresee situations in those countries?
Well, Rezwan was my former student, and he's doing a PhD in Colorado at the University of Colorado. So thank him for his great question. It's a good one. I think the point to be made, though, is that, you know, democracies are not monolithic. They're not all the same. Authoritarian regimes are not all the same. There is a variation. There is a spectrum. So I think fundamentally what Fukuyama was arguing is that state capacity, the capacity of the state to do the right thing during a moment of crisis, does fundamentally matter. But social trust also matters. And usually those societies that are democratic have higher levels of trust. You can have situations where you have sort of very weak democracies. And I'm not talking about democracies that simply have elections. My use of the term democracy is democracy at a much higher level, where you do have free and fair elections, but you also have an element of social justice and social redistribution. You have basically a social safety net. You have a public health policy. You have you know, the capacity of the government to do things properly in the moment of a crisis. So many of the democracies that Rezwan was referring to, I think, are going to be very weak and unable to respond adequately, particularly if you're dealing with, you know, if you're dealing with huge populations with the absence of good public health policies in place and options for citizens. I mean, if sort of, you know, take Indonesia. Okay, Indonesia is considered to be a democracy. It's got some problems in it, but it also has over 230 million people. What happens if the global pandemic hits, you know, Indonesia really hard? Is Indonesia going to be able to respond effectively when you have, you know, tens of thousands of people being contaminated, perhaps dying every single day? I mean, no country in the world will be able to have the health capacity to respond to that type of, you know, crisis. So I think those countries are going to be in really difficult situations. But it's a good point. I think it forces us to sort of think about different types of democracy and different types of authoritarian regimes that are able to sort of respond to these particular global crises.
Mm-hmm. Moving to the next, there's another two questions here. First by Nagib Yunus, and second, which is remain anonymous. The topic, the questions that they are posing is how does it relate to the current situation with the main point which you addressed quite comprehensively during your earlier talk, which is about trust. And you addressed about the point on one of the key components of differences between an authoritarian regime and also and a system of governance which is more democratic is the capability when it comes to encouraging trust among the populations to the leadership. The first question puts into looking to a bit more specific when it comes to trust towards the governance, meaning to say that trust is not necessarily just towards a government as if it's a president or a prime minister, the top of leader of the country, but it is also about trust when it comes to the health institution or health as a system. I'm giving an example in the case of here in Malaysia. Almost every day, the director of the health will be the one briefing and updating on the current updates and the situations either of new infections or lives which have been caused due to the situation, instead of having a minister or having the prime minister to talk about the health issues. So on this matter, do you see that when it comes to dealing with specific issues which relates to health, which we may think that it is important to have someone who have that credibility from health expertise to brief and talk about this, or it is actually should be dealt by someone which is more having a national figure, meaning the leadership figure of a president or a prime minister or things like that?
Yeah, I think the second is much more preferable. So in Canada, for example, I mean, I was born in Canada and I have Canadian citizenship, so I follow the politics in Canada very carefully. What happens in Canada is the Prime Minister comes on every day and gives an update on what's happening, and then he turns over the microphone to the leading health specialist in the country to give an overview of what's happening, because there's a perception that because the Prime Minister comes from a political party, it's better that a leading health specialist who is beyond politics update the country on what's happening and sort of, you know, give advice on how to handle this particular moment of crisis. So the point about social trust during moments of pandemic fundamentally relies around the ability of a government to guide, to organize, and to mobilize society in the right direction, to follow a set of policies that will help resolve the crisis. If you have a government in power that lacks social trust, that is viewed as being corrupt or partisan or really caring about the interests of one segment of the country, one ethnic group, one religious group, then people are not going to listen to the advice and to the recommendations of that government. They're going to think that the government is lying, most likely because it has a track record of lying. You're not going to be able to do the things, particularly in terms of, you know, mass mobilization, to observe social distancing, to stay at home, and to, you know, follow a game plan, a strategic game plan that can get you through this crisis. So I think very much that's the relationship between trust, government, and pandemics. It's the ability, you know, to have that capacity for people to view the government and to believe that the government is following scientific data. It's pursuing policies in the best interest of everyone, not just the best interest of the people who support that prime minister or that president. And so that's why I think, you know, having some public health official who is not, you know, connected to any political party being the lead spokesperson, updating the country, advising citizens on what to do, is the much better preferred option. You know, one of the problems that we're facing right now in the United States is you have Donald Trump, who is the president, who is, you know, he's half the country likes him, half the country hates him. Luckily, you know, you still have, and this is, I never thought I would praise Donald Trump, but I'm going to do it right now. He has organized a coronavirus task force, and he has two very prominent scientists and medical physicians who come every day to the press briefings and answer questions. Dr. Anthony Fauci and Deborah Birx, who are, you know, world experts in the field, and they're the ones who are sort of informing the president. And when they speak with a sense of authority, honesty, integrity that everyone in the United States, regardless of where they stand politically, tend to listen to those people because they're considered to be, you know, non-partisan experts.
Interesting input on that one, because it shows that when it comes to, it's not just about governance in the sense of democratic or authoritarian government, but it also shows that in such situation, new levels of authorities responds in different ways, in the sense that expertise, medical experts now becomes authorities, and these are the ones which could explains more about have more better social and public trust. I'm going to raise one question, mainly coming from my own interest, observing at least based on some news reports in Malaysia, definitely, and also I think it's quite the same in some other countries as well, which is how does the our situation now on the virus COVID-19 is actually affecting, and it's also in some ways changing religion and public life. It is quite an important topic, especially in the case of Malaysia, because one of the main outbreak clusters, which is in Malaysia, is mainly associated to religious activities, mainly one of the main gathering by the Tabligh Juma'ah movement.
Mm-hmm.
And that is being seen as one of the main cluster which come up, which have caused a lot of the spread of the virus. There's several implications or consequences have been caused by this. One of it is how we see that the responses from religious institutions or religious authorities on the matter in Malaysia, and not just that, and not just only that, but we could also sense some elements of stigmatization towards certain religious community groups because of they are being seen as causing issues and troubles. I don't want to go towards that part of the discussion, but based on several reports, I also noticed that it is not only the case of Malaysia. In several other countries as well, there's very much a close relations between the situation of the virus and how is it also affects other religious communities, Christian communities mainly in Europe and also in America, in India as well. And going back to the situation in Malaysia, at least to me, it is something like it is an untested situation before. How would religious communities respond to such situation? And effectively now, Friday prayers are almost in a situation it is no longer being allowed to do Friday prayers. There are several communities, members of the communities, some of them were arrested because of attending Friday prayers. And Islamic authorities, mainly the leaders of the Islamic departments, comes up with statements on how do Muslim communities need to respond to this situation. And it also relates to some changes in terms of how do you want to do your adhan, you're calling for prayers and encouraging more of doing prayers at home. Looking into this relation between the spread of the virus and the threat to the community, while at the same time looking into another part of an important principle of democracy itself, which is religious freedom. How do you find the situation about whether do you find some contradiction in this situation, and how do you see what is the best way to accommodate these differences?
No, it's a very good question, and we're seeing this play out before our eyes. Governments now, generally speaking, have tried to, advise their citizens not to gather in public places. In many places, Jummah prayer have been canceled. I predict very soon that Hajj this year will be canceled. But what you see is a dichotomy between what official state government officials are saying about religious practice in public, and then what individual Muslim groups, leaders, imams are saying to their own supporters. And in many ways, these two groups are talking at cross purposes. This is not unique to Islam. You can read what's happening right now in Israel, where these ultra-Orthodox groups are not listening to government guidelines, and they're just going to their religious places because they cannot conceive of daily existence without practicing their religion. This is in many ways a global problem. More so, historically speaking, not just in the Muslim world, but in traditional societies everywhere, during moments of great crises, of pandemics, people naturally flock to religious places, shrines, mosques for prayer, seeking God's support and sustenance during this calamity. When you can't do that, culturally speaking, it poses a problem for many people. And I don't think there's any easy sort of solution here. I mean, you can't physically arrest hundreds of thousands of members of the Tabligh Jama'at in Malaysia or in Pakistan and say you can't gather anymore. All you can do is try and meet with the senior leadership of these groups, try to sort of convince them that what they are doing is putting in jeopardy the lives of their own supporters and putting in jeopardy the global public health of everyone else in society. So this is one of these unique moments that we really haven't faced, at least not in my memory, where you have an emergency crisis on your hands, where the normal routine, the normal religious practices that we have gotten used to, going to Hajj, Friday prayer, gathering in mosques, all of those things in the name of public health, in the name of keeping people alive, have to be completely rethought. And all you can do is try and persuade people. If you try and I think use physical force, that creates a lot of other problems. I think, if I was advising the government, I would advise them to try and meet with these religious leaders who have influence over their followers, and to try and sort of convince them that their attempt to gather in public places and to ignore these guidelines is creating a catastrophe. Now, of course, one of the problems that we're seeing, and I followed this event, a little bit because it's in the news and it relates to this question of social trust, transparency, and democracy. Many people in many parts of the Muslim world don't believe there really is a coronavirus crisis. They think it's a conspiracy. They think it's, a concoction. It's an American sort of, problem that they've sort of developed. And so, when some people, not all of them, but many traditional people, when they're, told about this virus, it raises doubts in their mind because they're living in authoritarian systems where they're surrounded by lies all the time. And again, we see one of the negative consequences here of authoritarian regimes. When you consistently lie and deceive and you don't tell the truth, then during a moment of pandemics, when you need people to rely on the truth, they don't believe you. So this is sort of one of the unintended consequences of the legacy of authoritarianism that we're seeing today in parts of the Islamic world.
Okay, at the moment, I haven't received any new questions, but I'm going to touch on one point which I've also raised earlier about no one really knows how long would this situation remain and whether it would continue for a longer term. Most reports which I've read online tends to say that it could take quite a long time because there's no guarantee that the vaccine can be developed within a short time, and there are various possible situations that could happen in the future. And one thing which is not being totally sidelined is that generally most societies would need to adapt to this situation of social distancing, control of movement for quite a longer period. And as Ali Salman also already mentioned, in part of his concern is also what comes to the future of the economy. And as you have also mentioned earlier about the future of democracy itself. If we try to see the situations going to continue for a more longer term, in some ways it also relates to we need to kind of accept the situation that the situation of freedom, liberty, and democratic rights may not necessarily be the same as before the spread of the pandemic. So looking into such situation, one thing is for citizens, for people, how do we need to adapt with the situation while at the same time emphasizing on the importance of democratic rights and the basic civil liberties, while at the same time, how do mainly democracy advocates should respond to this if you are thinking about the situation could be happening in a longer run? Is it just we say that, okay, it is a time for definite compromise, or that we need to rethink about how do we actually promote democracy in such situation, especially in preparing for if things could happen again in the future, besides then the situation of COVID-19?
Yeah, no, those are good questions. You're right that the predictions are that this crisis is not going to end anytime soon. And even if the numbers start going down, the predictions are that there might be multiple waves of this coronavirus coming back. And until we get a vaccine, this could last for many months. If not, it could be cyclical until next year. So how do you respond? How do democracies respond in this particular moment? How do citizens respond at this particular moment of crisis? I think if governments try to consolidate power, try to roll back rights, try to postpone elections, try to invoke emergency sort of procedures, claiming that we have a national crisis and we can't have elections anymore, or we can't have debates anymore, or we can't have a free press anymore, then I think citizens have to fight back. Now, if you get a situation where there is calamity and catastrophe, where thousands of people are dying every week, when things are really catastrophic, then I could understand that during those unique moments, when you have, when you have hundreds of thousands of people whose lives are on the line and who might be dying, I can understand emergency procedures taking place during those unique moments. But I think there are ways of handling those crisis moments by insisting on regular intervals of review, of accountability, to not allow this to just drag on forever. But let's say a government wants to sort of use emergency powers to deal with a crisis, it has to be for a limited period of time. It has to be subject to parliamentary review. It has to be subject to some sort of checks and balances. It just can't be what we're seeing today in Hungary or what we're seeing today in Cambodia, where a government says, look, I just want all the power and I'm going to use it, and there's no limits or checks or balances. So I think one has to be very careful to not let the little democracy that we have in various Muslim societies slip away, and allow governments to manipulate this moment to consolidate power, because this is a perfect opportunity for those authoritarian leaders, political parties, to manipulate this moment to consolidate power in the name of a national emergency, but really with the goal of trying to preserve their own political careers. So one has to be very vigilant and very careful. I think it's also an opportunity for democracy. And it's an opportunity for democracy in the sense that, the way that countries are going to manage this moment of the pandemic is by having, what Ali mentioned, good public health investments, procedures, options for citizens. Societies that I think have invested in those things are going to be able to manage this crisis better than others. And that demands, accountability from government, resources developed to make sure that people can have the access to healthcare that they need in many parts of the Islamic world. In many ways, I think Malaysia, I don't know the state of healthcare in Malaysia. I think it's probably much better than other parts of the Islamic world, but in large parts of Africa, large parts of, Pakistan, Egypt, where you have huge populations and you have corrupt, governments, you're not going to have the health options that you need. And so that can be a demand for citizens to sort of insist that any future government worry about providing basic health care for its citizens. And that could be part of the democratic demands and the democratic sort of goals that citizens should be aspiring for in the context of their own struggles for democracy.
Okay, thank you very much, Dr. Nader. Just before we finish off our discussion for today, I will invite again Ali Salman to, is Ali still here?
I don't see him, so I think we may have lost him. I don't see him on my screen. Oh, there he is.
Ali? Ali Salman?
Yes, sorry.
Yeah.
I think there was some problem at my end.
Okay. Just like to invite you for some closing remarks on how do you foresee the discussion?
Oh, I thought I had already offered my remarks earlier on in response to Dr. Nader's excellent commentary.
Then, yeah?
They were very good remarks. Very good remarks, Al.
Yeah.
Yeah. I think I appreciate the fact that today in today's discussion we were able to actually take a broader view of how different governments are responding to this crisis, and this is important to reflect on the long-term implications. I think today's discussion is more futuristic in nature. I mean, of course, the health authorities all over the world are scrambling to mitigate this crisis, to minimize the public health losses, to minimize the life losses. But it is important that at the same time, academics and think tanks all over the world also keep on reflecting on the developments as they take place, and draw lessons for our governance at large, and draw lessons for globalization, draw lessons also for the both political system as well as the economic systems. So I think I really appreciate today's presentation by Dr. Nader, and also the question and answer, and also Ehsan for bringing kind of a huge variety of issues in which we were able to cover politics, but also healthcare, and also personal liberties, including religious liberties. It is indeed a very, very complex challenge, and as Dr. Nader mentioned in the start of the presentation, I think it is probably the biggest crisis that we are witnessing, definitely in our lifetime, and also in last several decades at the global level. So I guess at this point, we hope to continue to reflect on the long-term dimensions of this crisis, and be engaged broadly with public, and also with the policy audience. Thank you so much, Dr. Nader, and thank you, Ehsan.
Great, thank you.
Thank you very much, Dr. Ali Salman. Thank you very much, Dr. Nader Hashemi. Thank you very much to all attendees who participated and posed questions for the discussion. One thing for sure is that the conversations on how discussions about democracy and the situation of our world will continue, including in Malaysia as well. And as for the current moments, that as we are also adapting to new situations of the crises, I would think that if new programs will be organized through using the online medium instead, we are also adapting to such situation as well. While we keep on the conversation going, just to make sure that I wish you all to be safe and to be healthy as well, Dr. Nader and other attendees, and look forward that we can have another discussion again on a relevant topic, perhaps in the coming few weeks. Yeah. Okay. All the best, and best wishes to you all. Thank you very much.
Thank you. Thank you to everyone. Stay safe. Assalamu alaikum. Stay safe. Thank you.